These are 8 unusual signs of vitamin D deficiency that you should never ignore. It is commonly known that vitamin D plays a critical function in preserving bone health. However, did you know that low vitamin D levels during pregnancy may also affect the risk of asthma in newborns? Millions of people worldwide suffer from asthma, yet its reasons are still unknown. Nevertheless, American researchers are looking at the possibility that protecting a pregnant woman's adequate vitamin D levels could shield her unborn child from developing asthma. According to research that was published in the American Journal of Health Economics, mothers who spend more time in the sun during the second trimester of their pregnancies may be able to lower their child's risk of asthma development by up to 23%. Vitamin D is necessary for maintaining the body's levels of calcium and phosphorus and is also involved in controlling bone metabolism. It operates similarly to a hormone as well. The fact that vitamin D has a receptor in every cell in the body attests to its extraordinary significance. Additionally, research suggests that having enough vitamin D in the body can lower the risk of acquiring long-term conditions like high blood pressure, diabetes, obesity, and certain cancers, including breast cancer. More often than one might imagine, vitamin D insufficiency affects about 1 billion people globally. About 42% of adults in the United States alone are lacking in this vital component. However, not many people are aware that a lack of vitamin D in the body can have major health effects that extend far beyond issues with bones. In this video, we'll discuss the importance of maintaining enough levels of vitamin D for general health and well-being, as well as 8 unusual signs of vitamin D insufficiency that you should never ignore. The symptoms of vitamin D insufficiency we're about to talk about are not only important, but they can surprise you, so listen carefully. In instance, one of these symptoms could be unexpected and call for emergency care. Number 1. You constantly feel worn out. Being fatigued all the time, even after doing routine everyday tasks, is a clear indicator of low vitamin D levels in the body. Breathlessness and a general sense of depletion are frequently experienced along with this fatigue. It happens because low levels of vitamin D cause the vital minerals, calcium and phosphorus, which are necessary for effective metabolic functioning, to be less abundant. Thus, feeling excessively exhausted while doing simple, non-stressful duties could be a certain sign of vitamin D insufficiency. Number 2. You are experiencing frequent hair loss. Although it is often known that stress is a factor in hair loss, excessive hair shedding may also be a sign of underlying medical issues or nutritional inadequacies. Low vitamin D levels have been linked to hair loss, especially by women. Yet, there is still a dearth of study in this field. Moreover, rickets has been connected to ALUPA-AR, an autoimmune disease marked by severe hair loss. The main cause of rickets, which is a vitamin D deficiency, is bone deterioration. Number 3. You suffer from depression and mood disorders. A noteworthy discovery has been made by recent Irish research that was published in the Journal of Post-Acute and Long-Term Care Medicine. A vitamin D deficiency has been shown to raise the risk of depression in people over 50 by up to 75%. This relationship results from the critical role that vitamin D plays in the body's proper operation, especially in the brain. Adequate levels of vitamin D are essential for the functioning of neuroreceptors, which are critical for brain communication and mood regulation. The effectiveness of these brain messengers can be compromised by low vitamin D, which may contribute to mood disorders like depression and bipolar disorder. Furthermore, low levels of 25-hydroxyvitamin D calcidiol, the main form of vitamin D stored in the human body, have also been connected to other severe disorders like schizophrenia and alcoholism. The liver changes vitamin D into 25-hydroxyvitamin D following exposure to sunshine or the consumption of foods high in vitamin D. This conversion is crucial for controlling mental wellness. Bipolar disorder is a complicated mood condition marked by cyclical depressive, and recent study has focused on understanding the molecular basis of euphoria mania, which varies in intensity and impact. Researchers at a center in Oakland, California, have discovered a critical connection between omega-3 fatty acids and vitamin D in fostering mental health. Their research indicates that these compounds have a critical role in controlling the synthesis of serotonin, a major hormone that affects mood, judgment, and social behavior. Number 4. You experience vertigo. Have you ever moved your head and had an abrupt sensation of spinning or movement, either of yourself or your surroundings? The term beneficial paroxysmal positional vertigo describes this illness. It's a typical type of vertigo in which a little shift in head position causes an exaggerated sensation of motion. Research has indicated a possible connection between the beginning of BPPV episodes and reduced vitamin D levels. This relationship is especially noteworthy in light of the importance of vitamin D for maintaining bone health and controlling calcium, both of which are essential for the proper operation of the vestibular system. For the preservation of equilibrium and spatial orientation, the vestibular system is essential. According to a recent American Academy of Neurology publication, taking calcium and vitamin D supplements may be an easy and low-risk way to avoid vestibular system-related illnesses. This strategy offers a straightforward technique that may help individuals experiencing vertigo by providing a possible avenue for relief from these disorienting episodes. Furthermore, vitamin D contributes to bone health, and alterations in the inner ear's bone structure can impact stability and cause vertigo and dizziness. Number 5. You suffer from an arrhythmia or erratic heartbeat. Vitamin D is crucial for cardiovascular health and goes beyond that. For the cardiovascular system to work at its best, sufficient quantities of calcium and phosphorus are required, and vitamin D is essential for controlling these minerals. As a result, vitamin D plays a crucial role in the heart muscle's contractions. A lack of it can directly affect the heart's capacity to pump blood effectively, which may result in arrhythmia or an irregular heartbeat. This suggests that getting enough vitamin D may be crucial for controlling or preventing arrhythmia, underscoring the vitamin's complex role in preserving general health and wellness. Number 6. You're prone to illness. Upper respiratory tract infections. One of vitamin D's most significant functions is immune system strengthening, which activates defense cells like lymphocytes to successfully fight germs and viruses that cause a variety of diseases. Low vitamin D levels may play a major role if you are prone to illness, particularly from colds or the flu. Numerous research supporting the link between vitamin D deficiency and a higher risk of respiratory tract infections, such as colds, bronchitis, asthma, and pneumonia, have been conducted. Number 7. You have problems with the health of your skin. Because of its effect on the look and vitality of the skin, vitamin D is known as the beauty vitamin and can have a detrimental effect on skin health. Low levels of vitamin D can result in a reduction in the formation of collagen, a vital protein that keeps skin tight and supple. This decrease in collagen can cause sagging, fine lines, and wrinkles to emerge, which can lead to early, unadulterated aging of the skin. Furthermore, a lack of vitamin D is linked to conditions like dry skin, which makes the skin harsh and lifeless. Additionally, it may make skin disorders like psoriasis, eczema, and acne more likely. Number 8. Impaired healing of wounds. Diabetes is known to be a major risk factor for wound healing complications, but vitamin D deficiency is also strongly linked to these issues since it promotes the synthesis of molecules necessary for the development of new tissue, which is a critical step in the healing process. A vitamin deficit can seriously hinder the healing process, according to a research done on individuals having dental surgery. Moreover, vitamin D has a crucial role in reducing inflammation and enhancing infection resistance. Severe vitamin D deficiency has been associated with elevated inflammatory markers in conditions such as diabetic foot infections, indicating more significant difficulties in the healing process. Knowing the proper daily intake of vitamin D is essential for sustaining health, in addition to being aware of the many signs of vitamin D deficiency. For people up to 70 years old, the National Institutes of Health advises consuming roughly 600 IU 15 mcg of vitamin D daily. The recommended daily dosage rises to 800 IU 20 mcg for people over 70. The basis for this variation in advice is the body's changing requirements as we age. Levels falling short of these suggested intakes may result in the previously mentioned symptoms, but it's also critical to understand that too high vitamin D levels can also be harmful to health, increasing the risk of problems like calcium accumulation throughout the body, particularly in the kidneys, blood vessels, lungs, and heart. There are three basic strategies to raise vitamin D levels in the body through diet, supplementation, and sun exposure. The most important source of vitamin D, making up around 90% of what our bodies require, is sunshine. The sun's ultraviolet rays cause molecules in our skin to be converted into vitamin D3. Requires sufficient synthesis. It's advised to spend 15 to 20 minutes each day exposing your back and torso to sunshine. There is no denying the role that sun exposure plays in the creation of vitamin D, but certain individuals are more vulnerable to deficiencies, particularly in the absence of supplements. A vitamin D deficit is more likely to occur in office workers and professionals with less sun exposure, such as shift workers and healthcare personnel. Because melanin absorbs UV rays, which reduces the skin's ability to generate vitamin D, those with darker skin are also more likely to be deficient. As a result, they might need more sun exposure to keep their levels appropriate. Vitamin D intake is also influenced by dietary sources. Rich in this vitamin are foods like butter, eggs, yolks, milk, mushrooms, and oily seafood like salmon, canned tuna, and tinned sardines. That being said, it's crucial to remember that eating food alone might not supply enough vitamin D. Another option is to utilize supplements, but only in accordance with medical advice, to prevent issues brought on by overconsumption. Taking supplements can be a dependable method to guarantee sufficient consumption, particularly when diet and sun exposure are inadequate. For general health and well-being, maintaining appropriate vitamin D levels requires striking a balance between these three sources. Please be aware that the only objective of this movie is education. Always seek the opinion of a medical professional for a thorough assessment and relevant guidance if you are experiencing health problems. We sincerely hope this information was useful to you. If so, give it a go and think about telling your loved ones about this information. Now, we want to know whether you have any of these vitamin D insufficiency symptoms. Please let us know in the comments section below. Maybe a sunny holiday will do you good.